Hello, we'll be studying now about a topic called mesentery. What is mesentery? It is a broad fan-shaped fold of peritoneum which suspends the jejunum and ileum from the posterior abdominal wall. I repeat, it is a broad fan-shaped fold of peritoneum which suspends the jejunum and ileum from the posterior abdominal wall. Now coming to its function, what is the function of mesentery? It transmits blood vessels. Indirectly, it gives nutrition and innervation to jejunum and ileum. The function is giving nutrition in the form of its blood vessels and innervation in the form of the nerve plexus around the blood vessels. Layers and its origin. This mesentery is two-layered and both are derived from the peritoneum of the greater sac. Coming to the presenting parts of mesentery. Mesentery contains a root or vertebral border and a free border or intestinal border. So this one is the root and this is a free border or intestinal border. Let us go with the root or vertebral border. It extends, if you see in this diagram here, the root extends from this one here, which is duodenojejunal flexure. The root begins from the duodenojejunal flexure, crosses many structures. It begins at this flexure at the level of L2 to the left of the L2, 2.5 centimeters. 2.5 centimeters to the left of the L2, 1 centimeter below the transpyloric plane. At the duodenojejunal flexure, the root begins, it crosses various structures and ends at the right sacroiliac joint coinciding with the iliocecal junction. I repeat, the root begins from the duodenojejunal flexure and ends at the right sacroiliac joint coinciding with the iliocecal junction. Now, coming to this other one, this root, the length of this root or this one is 15 centimeters or 6 inches. The important thing in relation to the root is which structures it is crossing. Structures crossed by the root are, I'll say this one, number 1, which is third part of the duodenum. Number 2, which is the abdominal aorta. This one is number 3, which is inferior vena cava. Number 4, this one, which is right psoas major muscle. Number 5, this structure, which is right ureter. Number 6, these structures here, which are right gonadal vessels. If it is a male, right testicular vessels. If it is a female, right ovarian vessels. And number 7, this one, genitofemoral nerve, right genitofemoral nerve. And number 8, right sacroiliac joint. The structures crossed by the root of the mesentery is important, particularly in MCQs. So I repeat again, these are the structures which are crossed by the root of the mesentery from left to the right, and they are third part of the duodenum, abdominal aorta, inferior vena cava, right psoas major, right ureter, right gonadal vessels, right genitofemoral nerve and right sacroiliac joint. So that is about the root. Now coming to the free border or intestinal border, that is this one, this border, free border or intestinal border. It is 20 feet in length. It is frilled, that means it is not straight. see here, since the intestine is showing the coils here, it is frilled. The free border can be said as frilled, but is not uniformly straight. It is somewhat convex at some places. Hence, we call it as a frilled border, and it is also called as intestinal border. It is attached to the jejunum and ileum. Okay. Now coming to the next one, that is the breadth. The average breadth of this mesentery here is 15 centimeters, coinciding with the length of the root, but the maximum breadth at some places is 20 centimeters. The place where, that means from the duodenojejunal flexure out of this 20 feet length of the jejunum and ileum, between 6 feet to 11 feet region, at that place the breadth is more, which is 20 centimeters, and that portion of that breadth is located in the pelvic cavity, and when there is peritonitis in the pelvic region, it can cause paralytic ileus, that means lack of motility of the intestines. Okay, that is about the breadth. And finally, the contents. The contents of this mesentery are definitely jejunum and ileum, number 1. Number 2, the vessels, that means jejunal and ileal vessels of superior mesenteric artery like this, forming an arterial arcades. Is it clear? So these are the jejunal, or if it is jejunum, it is jejunal arteries. If it is ileum, it is ileal arteries. Number 3, the nerve plexus around these blood vessels. Number 4, the intestinal lymphatics in the form of mesenteric lymph nodes, which are 100 to 200 in number. That is number 4. Number 5, loose areolar tissue. Number 6, a pad of fat. That fat is confined to the root. The fat is confined to the root of the mesentery, confined to the intestinal border in case of jejunum, and it is deficient elsewhere. Hence, a translucent windows can be seen which are rectangular in shape in case of jejunum, whereas if it is ileum, the fat is uniformly distributed. Hence, translucent windows are not seen clearly. If present, they are square in shape. The last content, we can say sometimes suspensory muscle of duodenum, accessory suprarenal tissue, and even sometimes the appendix. Tip of the vermiform appendix may be contained within the mesentery. This is all about a small topic called mesentery. Thank you.